Hello, my name is Vicki, and I do YouTube videos for BMS and LPR. BMS is a burning mouth syndrome. Burning mouth syndrome is when your tongue feels like it's on fire. It has almost like a scalding feeling, and it can move from the back of your mouth to the middle, to the front, to the left, to the right, and that's not always the case for all of you. I realize that, but some of us, the burning does move around. And LPR is a type of acid reflux, also known as respiratory reflux. And the word is really long, so I'm not going to go ahead and say what it is, but just look up LPR reflux and it probably will pop up if you do a Google search. Or you can inbox me on Facebook. Okay, so LPR is when you have burning mouth syndrome symptoms, as well as burning of the roof, burning of the sinuses, coughing, hacking, you can have burning of the ears. My burning of my ears happen when I lay down at night and I have acid channel up into my sinuses and up into my ears. You can also have dry eyes and dry mouth, as well as sore throats, postnasal drip, globus, which feels like something's caught in between your sinuses and your throat at times, or all the time, which is my case. There could be other symptoms out there. Mine kind of started with 2 months of dry mouth, and then it just, after my dentist appointment, it just seemed like it just spurred on something. I will say though, before my dental appointment, for probably several years, I had tightness in my chest, but never any heartburn. And it seems like since I've had all the hacking and coughing and all those problems, actually I had it for 9 months, I went on a very strict diet. But before all that, all this came on, I did have a tightness in my chest, and I no longer have that. So I hope that doesn't return either. That went on for years. I never associated it with acid reflux. I didn't know what the cause was of it. So I went on a very strict diet. I lost 75 pounds. I went on an acid reflux diet, which you could just basically Google online. It's basically not consuming anything with caffeine, meaning like tea, coffee, soda, chocolate, some of my all-time favorite things that I would probably consume on a daily basis. Also, you want to avoid onions, spicy foods, and gosh, even avocados, oddly enough, fatty foods, acidic foods, things of that nature. With LPR, this type of acid reflux, you will want to prop yourself up on pillows nightly. Do not eat after 6 o'clock. And seek the advice of a GI specialist. Perhaps a type of medication may help you. I was on a Meprazole, 40 milligrams twice daily. I am no longer on it. As of 3 months ago, my symptoms cleared up. I was very symptomatic. For an entire 9 months, I had very severe symptoms. It felt like when I hacked and coughed and spit up all this acid and globs that I just felt like it was never going to end. And I had Kleenex boxes that I'd carry around daily and nightly, and it was just really rough going through that. I'm glad most of my symptoms have cleared up. I still have the burning mouth, and I still have acid that channels up into my sinuses and in my ears, and I have a yucky taste when I wake up in the morning, and I even sometimes have some little white speckles on my tongue. Anyhow, I'm going to be getting surgery soon, and because my my acid reflux is due to both, I have a hiatal hernia and a LES, lower esophagus sphincter issue. I need to get a stretta surgery because I have degeneration of my LES, and I had an esophageal manometry that showed the dysmotility of the LES, which again is the lower esophagus sphincter. There is a lot to be done as far as seeing an ENT to see if you have LPR first off, then go to the GI specialist, have an endoscopy, see if you have a hiatal hernia. And then if you opt to have surgery or get on a PPI, which is a medication for it, or if you opt to get surgery, there's Nissen, TIF, Stretta. I'm having the Stretta surgery due to the degeneration of my LES. I don't have all the answers, but I try to piece things together the best I can by the information that I gather, primarily from doctors and sometimes group members and a lot of research. It is up to everyone to do their own research, find out what's causing your BMS or LPR, and hopefully what little information I can provide can help you or guide you down some type of positive road. It's been a difficult path for me. So that is why, excuse me, I'm going to get a little emotional. It's been a very, very difficult path. You'll find along the path too, I've seen probably maybe 15 specialists, even infectious disease. It's a lot of work. So the faster you get to the specialist you need to see, the faster you can, remedy this. It's been almost a year, and I am hoping to catch a break and come back and report some positive feedback. So thank you for everybody's time and listening to my YouTube videos, and please leave messages for me and I will get back with you. Thank you. I can be found on Facebook, VICKIE, last name MNIS. Talk to you later.